Cholesterol-lowering drugs could help slow down the progression of Alzheimer's disease, scientists say. Thousands of patients treated with these medications, called statins, showed reduced brain congestion in a recent study, news.com has learned. Researchers at Karolinska Institutet in Sweden analyzed data from more than 15,500 patients with dementia, 11,000 of whom were treated with statins, and their findings were published in the journal Alzheimer's Research and Therapy in December of 2023. In general, the patients who were treated with statins had slightly higher values in the cognitive tests carried out, even though they were more likely to have diagnoses such as high blood pressure, cardiovascular disease and diabetes, all of which are risk factors for dementia, a statement describing the study said. Statins work by blocking a substance the body uses to make cholesterol, but the medications have also been linked to a lower risk of heart disease and stroke, according to the Mayo Clinic. Historically, these drugs have been suspected of actually confusing patients with dementia, which has led to some reluctance in prescribing them to these patients, according to the researchers. The study authors also said this association reinforced their emphasis on safety and made them cautious in their interpretations. People with Alzheimer's dementia treated with statins had better cognitive development over time. However, the results of the study do not mean that we now have evidence that people with dementia should be treated with statins, Sarah Garcia-Tachek, lead author of the research, said. But on the other hand, we can't see any support for not doing so. So, if a person needs statins for high blood lipids, a dementia diagnosis should not stop the treatment. The findings suggest a potential protective effect of statins against cognitive decline in some Alzheimer's patients, but determining which specific subgroups benefit most would help inform future clinical trials. We believe that only certain patients with Alzheimer's dementia may benefit from statins and that previous clinical trials have been too small to show any significant differences, Sarah Garcia-Tachek, a co-author of the study, said. Our idea is to try to crystallize which patient groups benefit the most and why, before embarking on clinical trials. The team said further studies should investigate the relationship between the drugs and Alzheimer's symptoms. The basic idea of this study was to pave the way for a more precise cohort study that could eventually lead to a clinical intervention study, which is what is needed to prove a causal link between statins and cognition, Garcia-Tachek said.